All right, welcome. Today, we're diving into a paper that's not just important, it's absolutely fundamental to our practice as vascular surgeons, and you guessed it, a real favorite in the FRCS Viva. We're talking about the heart protection study. So picture this. You're in your Viva, and the examiner leans forward and asks you to summarize this study. By the end of this explainer, you're going to have a rock-solid, consultant-level answer ready to go. Okay, let's get into it. Okay, here's our game plan. We'll run through the background, the study design, check out the key results, talk about the impact and limitations, and then wrap it all up with that perfect Viva-ready summary. Right, let's set the scene. The heart protection study, HPS for short, landed in the Lancet back in 2002. And look, this wasn't just another statin trial. Its whole purpose was to clear up some major confusion about who really benefits from lowering their cholesterol. And that brings us right to the big question they were trying to answer. You see, we already had some big trials like 4S and WOSCOPs, and they'd shown that statins worked, but mostly for middle-aged guys with known heart disease and high cholesterol. The million-dollar question was, what about everyone else? Does this benefit apply to all the other high-risk people we see? And these were some pretty big gaps in our knowledge back then. We really didn't have solid proof for patients with things like PVD or diabetes but no known coronary disease. Women, the elderly, they were almost ghosts in the earlier trials. And here's the real kicker, what about patients whose cholesterol was already considered average or even low? Did they benefit? Nobody knew for sure. So HPS was specifically designed to go after every single one of these uncertainties. Okay, so with all these huge questions on the table, the researchers needed a seriously powerful study design to get clear answers. And honestly, the way they built this trial, its sheer rigor, is a huge reason why the results were so game-changing and why we still talk about it today. So let's break down the design. This thing was massive. A huge, randomized, controlled trial with over 20,000 high-risk patients. That huge number is really key because it gave them the statistical muscle to look at all those different subgroups we just talked about. The setup was simple, 40 milligrams of Simvastatin every day versus a matching placebo. They followed everyone for about 5 years, and they were looking at the big, hard endpoints, dying from any cause, and what they called major vascular events, or MVs. So, what did this massive trial actually find? Well, the results were overwhelming. They weren't just statistically significant, they were so clinically important that they changed practice almost overnight. Okay, if you remember one number from this whole thing, make it this one, 24%. That's the magic number. Taking Simvastatin cut the relative risk of having a first major vascular event by 24%. And statistically, this was absolutely rock solid, with a p-value that was, practically zero. And if we look at the actual numbers, it's really striking. In the placebo group, about 1 in 4 people had a major event over the 5 years. But in the Simvastatin group, it was closer to 1 in 5. That difference, that 5% absolute risk reduction, is a huge deal when you're talking about this many people. It's incredibly meaningful. And this wasn't just about preventing heart attacks. Nope. The benefit was seen right across the board. We're talking a significant drop in people dying from any cause. Major coronary events, down by 27%. Any kind of stroke, slashed by a quarter. And the need for things like bypass surgery or stents, also down by 24%. Just amazing, really. But here's what really blew everyone away. That 24% reduction, it was there for everyone. Men, women, older folks, people with diabetes, people without, it didn't matter. And, this is the most important part, the benefit was just as strong in patients who started with a normal LDL cholesterol, even below 3.0. This completely turned the old idea of treating to a specific cholesterol number on its head. Okay, so that leads us to the impact of the study. But wait. Before we get to that, for a proper critical appraisal in your Viva, you have to talk about the limitations, right? So a couple of things to mention. They had a run-in period where everyone got Simvastatin first, which might have filtered out people who couldn't tolerate it or wouldn't take it. It's also good to mention it was industry-funded. And finally, they only tested one dose, 40 milligrams, so it didn't tell us about dose response. But even with those points, the study's influence was just massive. It completely changed the game. Before HPS, our whole focus was on treating a number on a lab report, that high LDL cholesterol. After HPS, the thinking shifted completely. It became about treating the person and their overall vascular risk. The key takeaway was that if you're a high-risk patient, you get the statin pretty much regardless of what your starting cholesterol number is. Okay, let's bring it all home. We're going to package all of this into a sharp, structured answer that you can deliver perfectly in your FRC's Viva. This is how you nail it under pressure. Just follow this simple 4-step structure. It's logical, it's clean, it hits all the marks. First, you state the background and the question they were asking. Second, you describe the methods. Huge RCT, 20,000 plus patients, Simvastatin versus placebo. Third, you hit them with the key number, that 24% reduction in major vascular events. And fourth, you wrap it up with the conclusion and the massive impact, that paradigm shift from treating a number to treating the patient's risk. So, if you're asked in the exam, the safe consultant answer would be something like this. Committing it to memory is a really good idea. It's accurate, it's structured, and it demonstrates not just what the trials showed, but why it remains an absolute cornerstone of our practice today.